and everyone to support each other. And we needed people there that had experience in doing these things. And experience gives you confidence. So you do sound like what you need is to go to countries that allow or have a lot of breech and twin births and gain some experience. I don't really know what to tell you if you are not allowed to do them in the hospital. See, the interesting thing is, even the obstetricians don't know how to do it. So you have a chance as a midwife to perhaps gain some skills that obstetricians don't even want to learn. That's the interesting thing. They don't want to learn because they can just do a C-section. I cannot do a C-section. I have mothers that don't want a C-section. I have mothers that are educated in birth. I don't mean a formal education. I don't mean university trained, but they have taken the time to say, this is what I want to do. This is what I feel is safe. And she wants to be surrounded by people that will aid her and think the same way. We even have women now in North America, if they can't find a midwife and if they can't find a doctor, they won't go to the hospital and they will do their babies by themselves. That's how strong they feel about having a baby naturally and having a baby their way. So it's much nicer if a woman can find a midwife that will come to her home or attend her in a hospital who also believes as strongly as she does in a natural birth process. Ladies, no one cuts babies out of animals. No one puts them on their back and puts their legs in the air. We leave nature to do things the way that what is needed to be done happens. And most of the time, just as Lily said, if you leave a lady alone and let her body birth the baby, but everybody is at peace and doing the best they can, and sometimes the best they can is just hands off, things will unfold. Most of the time, 98%. Ladies, all I can tell you is babies are born healthy when mothers are all by themselves. Babies are born healthy. Have you seen those shows on TV where the mother didn't even know she was pregnant? Which I find kind of impossible, but she didn't. And all of a sudden she gets some pains and she has a baby in her own home, or because she didn't even know she was pregnant. Now, that baby grew perfectly. That baby grew healthy. That mother's body knew how to birth, and the mother didn't even know she was pregnant. Animals do the same thing. Maybe they know they're pregnant, but nobody helps them. But we make sure they're in a place, where they've had good food, where they're safe. If you talk to any farmer or anyone that looks after animals, be that a cat or a dog, the thing is that if you have to just leave them alone and let them follow the needs and urges of their body, and the babies will slide right out. So I don't know how to give you the feelings that I have, but I only have them because I've sat and seen the broad range of normal. Birth is a normal process for women. No one tells us how to have a bowel movement. No one tells us how to digest our food. We can put good food in our body and have a healthier body. We can educate the mother. We can facilitate the mother so that her birthing and her body will function with less stress. Stress is what causes all the problems in birth. Stress from the environment,
Exactly.
stress from the family.
Exactly. Sorry, I interrupt you, because the point that you mentioned is completely true. Because Fatima Qudsi is written that we have a twins birth in Iran. The first baby, it was cephalic and delivered already, and the second baby, doctors came to deliver. I want you to go to this point. If second baby doesn't come fast after birth, first baby birth, what we should do? Shall we be this much stress and do invasive work, start centers, that I want to hear from you that what is the management of second baby if there is no more contraction and no progress of labor?
Well, I think nature wants the mother. Think about this, ladies. The first baby comes out. That baby maybe is crying or maybe it's not, and you do a little bit of neonatal resuscitation, but whatever. If a baby comes out and it's crying, the second baby, I've had mothers wait 1 to 2 hours between babies. We monitor the heart tones of the second baby. We watch that the placentas, there's no bleeding, the placentas are not coming off the wall. And if the heart tones are good, we wait. I just talked with a midwife that waited 24 hours between babies. And I've read stories of people that had twin babies 1 week apart, a week, a whole week. Now, I have not had that experience, and I'm not sure how comfortable what I would be with a week, but there are reports of that. But I have had many, many women that have at least an hour to 2 hours between babies. We monitor them, they get up, they go to the bathroom, they're holding on to one cord that has the cord clamp on it. And they go to the toilet and they come back and they kind of dance a little bit and dance the second baby down. But if the heart tones are good and no bleeding, then you wait. What is the problem? But if you get stressed and the mother gets stressed then labor will stop. We all know labor stops when a mother is stressed. Animals do it all the time. They do. If you interfere with a mother, then it's, ladies, I'm going to say this, and you cannot have a sexual orgasm if you're having stress. Birth is an orgasmic experience. You have to have the mother in a place where she can make sounds, where she can use her body as she needs to use her body. But you can't limit it. You cannot say we have to get this baby out. Now, that's all I can tell you. You have to wait. But I guess in hospitals, if they have all these protocols, that's why so many women that are educated about a hospital birth experience don't want to go there. And it's getting so bad in some places that they don't even want a midwife because they can't find a midwife that's confident, that they'll rather do it by themselves. We don't want that for our women. I want women to feel safe and loved and cared for. And just in case I have some skills that might help her, I don't want her to have to think that she has to birth by herself. It's very sad, ladies.
Yeah, that's so sad. Sarah is asking if the first baby born, for the second baby, maybe cervix get closed.
No,
And
no,
so what we
does
should
not
do?
happen. Does not happen. Does not happen. No, the cervix stays open. No, it does not close. It's an elastic thing. It might collapse a bit, but it's still been dilated. It's still open. It's still soft. It's like, the baby comes through the cervix. This is not the vagina. The baby comes through the cervix the same way. And when the baby's out, it relaxes, but it doesn't seal up again. No, it doesn't.
Great. Thank you. I think Khadija wants to share her story in Persian and I translate to English. It
Okay.
is okay خدیجه میخوایم به فارسی بگیم من کوتاه کوتاه بگیم که من بتونم ترجمه کنم. Yes, share your experience. Yeah, can you please give access to Khadija? Unmute Khadija, please.
سلام هم دکتر، وقتتون بخیر.
سلام، قربون شما، مرسی. وقت
زنده
شما بخیر. بفرمایید، خواهش می‌کنم.
هم دکتر در رابطه
فقط کوتاه بگیم که من کوتاه ترجمه کنم.
در رابطه با تجربه اینکه خودم یک زایمان دوقلویی رو تجربه کردم، چون من هم دکتر میگم که توی تحصیلات زایمان بودم و کیسای اورژانسی زیاد می اومدن اونجا. بعد با اورژانس یک موردی رو برای یک مورد خانم باردار آوردن و خوشبختانه حالا فول بود موقعی که اومدن تحصیلات. پزشک مرکزمون به من کانسالت که کردم گفتن که باید حتما اعزام بشه، ولی مورد جوری بود که رپچر ممبرین بود، وضعیتش جور بود که استیشن پایین بود. بعد یعنی قشنگ میشد این زایمانش رو بگیری. توی سونویشون نوشته بود که مثلا قول اول سفالیک هستش و قول دوم بریج هست. به خاطر همین خیلی پزشک متخصص من رو به قولن یعنی فشار آوردن، گفتن که این حتما باید اعزام بشه. ولی موقعی که من خوشبختانه زایمان قول اول رو گرفتم، بعد دیدم توی اکزامم دیدم گفتم که این مورد یعنی قول دوم هم چیز هستش، سفالیک هست. با پزشکمون از دوباره کانسالت کردم. خب میدونین که هم دکتر اصلا توی ایران نمیذارن متاسفانه ماما بخواد یعنی یک زایمان دوقلویی رو میگیرین، خودتون دیگه این رو دیگه واضح دیدین هم دکتر. من از اون طرف قولن یعنی یه شجاعتی دیگه به خرج دادم اینجا و با قاطعیت گفتم که هم دکتر بریج نیست، قول دوم سفالیک هستش. و خوشبختانه من میگم که قول دوم هم خدا را شکر به دنیا اومد و هیچ مشکلی پیش نیومد. من فکر نمی کردم، چون هیچ تجربه ای از زایمان دوقلویی رو هم دکتر من نداشتم و واقعا توی یک چیز به قولن یک موج استرس زیادی بودم. هم نگران جان مادر بودم، هم نگران جان بچه ها بودم. از طرفی میدونستم که اگه این مورد بخواد اعزام بشه بین راه ممکنه مشکلی پیش بیاد برای بچه ها، اونجوری خطرناک بشه، چون دیگه وضعیت رو من جوری میدیدم که مثلا استیشن پایین بود، رپچر ممبر هستن، همه چیز برای زایمان مهیا بود. که من این تجربه رو توی تحصیلات زایمان بدون اینکه پزشک چیزی هم در کنارم باشه خدا رو شکر داشتم. و بله.
Very good. Merci Khadija. Khadija, she was working in primary health center in Iran. Iran in some, I can't say some villages, we have a small primary health center that's running by midwives. And if you have some complicated cases, you have to refer them to the city or nearest facilitated hospital to the doctors or surgeons. So she had a case, there was a mother, when she reached with complaint of pain, she was fully dilated and her ultrasound report was showing that she has a twin. First baby is cephalic and second baby is breech. So she got confidence because she was thinking if she wants to refer this patient, this mother, with ambulance to the nearest hospital, maybe mother delivered the baby on the way and it will be more risky. So she accepted all of the responsibility and delivered the baby, the first baby, in the hospital, in this primary health center, against of her support gynecologist, because she was not agree to do this birth there because the second baby was breech presentation according to ultrasound report. Anyhow, she accepted all of responsibility and she did manual exam, found second baby is cephalic, so she could convince the doctor for managing her birth in that